again, Dr. Doran.
Hello again.
So all of us, or a lot of us, do suffer with the lower back pain. I know my husband does, and actually shoulders. So what is it that you can do for an ailment? I mean, we all kind of just want to just live with it because we just figure that's just the way it's going to be, especially the older we get. What is it that you can do to relieve that versus us going and getting or taking any kind of painkillers or anything like that? What is it you can do to help with that sort of a problem?
For one thing, we can make adjustments, again, nudging the body in the correct direction. Instead of making a permanent solution that might help the body and it might not help the body. You've heard about patients who are urged to do surgery on their low back, fusion. Half of them do not work. The success rate is 50%. And the success rate is 5 years down the line, you're not complaining about the same stuff you were 5 years ago. Doesn't mean you're any better, just means you're complaining about different stuff. That's a medical success. Whereas we can actually help people by adjusting the little tiny joints that are responsible for holding the back together. By adjusting those little tiny joints, we can make a difference in the whole back. There's little tiny nerves in those little tiny joints. And by adjusting those nerves and joints, we can influence the entire body.
Dr. Doran, there is one thing I did want to ask you. Do you take insurances of any kind?
Yes, most medical, quote-unquote, insurances will have a provision for chiropractic. Sometimes it's a certain amount, sometimes it's a certain number of visits, but most of them will take some form, not Medi-Cal.
Okay.
But all the other insurances will accept chiropractic treatments.
Perfect. Thank you so much. I appreciate your help.